Before I begin, I want to respectfully acknowledge that I'm joining you from traditional territory of the Lenni Lenape people in what today is called Philadelphia. And of course, in thinking about the global trans health work I'm going to talk about, I think it's really important to us for us to remember that sexuality and gender-based oppression were really central to European colonization from these lands to India. And that there always have been many ways of living and imagining gender that go beyond the words or concepts like trans, which I'm going to use today, but recognizing as well its limitations. And I also want to just say at the outset that it is the middle of the night in India. So Shaman is joining through a pre-recorded video and may try to duck in for the Q&A, but also does need to sleep. So we'll understand if he doesn't, but I'm really glad that he could join at least virtually today because he is more expert than I on most of what I'm going to talk about. So what we'll do today is we'll first talk about transmasculine health globally and some of the research gaps and opportunities that we've identified. Shaman will talk about the context for transmasculine people in India and introduce the study that we're conducting. I'll share some preliminary findings from the qualitative phase of our research and then talk about next steps for our study. So to begin, one of the motivations for this work is a real gap in research globally on the health of transmasculine people or trans men, so trans people assigned female at birth in low-income and middle-income countries. This is from a review that many of you have probably seen that was published in 2016 in The Lancet that looked at quantitative trans health research published from 2008 to 2014. And in this review, there were 116 studies identified. And of those studies, there were 3 that reported any disaggregated data on the health of transmasculine people in any low-income or middle-income country. There were 2 studies from Iran and 1 from Thailand. More recently, our team that's working on this study, one of the first things we did in our project, conducted a scoping review, and we looked over a 20-year period at research published from 1999 through 2019, and we looked at qualitative and quantitative research, peer-reviewed literature, conference abstracts, gray literature reports. And we found 39 peer-reviewed articles, 3 conference abstracts that were published, 11 gray literature reports that had any disaggregated data on trans men's or transmasculine people's health in low-income or middle-income countries. And that we define that very broadly. So if a study had a single qualitative quote from a transmasculine participant, we included the study in our review. And we still, over 20 years, found very little. The picture here on the left, by the way, is from a video summary of the scoping review that's on the project website in both English and Hindi. And you can see here the geographic distribution of the studies that we found. There were 4 from India, 2 of which were in the peer-reviewed literature. And one thing that really stood out to me as an epidemiologist, when we looked at the quantitative studies, which was about half of the studies that we included, the majority had fewer than 50 participants. So as an epidemiologist, there's not really much that you can do with that data other than some very basic descriptive statistics. And we looked at the domains that were addressed in these studies. The largest grouping were those that were focused on gender affirming care. A lot of that was data from gender identity clinics that was arguably often quite stigmatizing in terms of the way that it was framed, and then also research that was focused on social determinants of health. And across both the qualitative and the quantitative studies that we included, there were some key cross-cutting themes that emerged. So one issue, not surprisingly, was around limited access to gender-affirming care, and therefore people accessing hormones outside of medical supervision. That's much less common in Canada because it's not that easy to access testosterone in the gray market, whereas in many places it's much easier to buy without a prescription. And then another theme, again, not surprising, were experiences of discrimination, violence, and coercion related both to trans status as well as to being a person assigned female at birth, and then how those two statuses intersect in people's lives. And to talk a little bit about the local motivation for this research, in addition to the global motivation, I'm going to turn it over to Shaman now.
Hi, everyone. I'm Shaman. I am a part of the steering committee and the research team for the study. Before we get into some of the findings from the consultations and some of the other details about the design of the study, I want to walk all of you through a brief history of the trans men movement in India. India in general had a very, very vibrant trans culture, and most of our scriptures do mention trans people as part of our culture and part of our integral society. However, after colonization, trans people were pushed to the margins and they were ostracized. Trans men in particular were highly invisibilized. In India, trans women lived in socio-cultural identities such as the Hijra community, the Kinnar community, but trans men, being in a very patriarchal system, were denied their identity and would often be facing gender-based violence at home. And hence, it was only up till 1998, till one of the first few groups of trans men that came up. And until 2014, there were fewer than 100 trans men across India who were in touch with each other initially through Yahoo mails and then eventually through Facebook groups. It was only in April 2015 when India Supreme Court came up with a landmark judgment that allowed the third gender as the transgender identity and gave people the right to self-identify themselves either as man, woman, or trans person. That was a milestone in the trans history in India. And the Supreme Court also guided the government to come up with policies and laws to protect the trans rights in India. Once the government started drafting the laws, we realized that most trans men were not even included in the table where the discussions were happening. Even trans women thought that trans men should not be included in the transgender umbrella because they felt that we were not living in the margins of the society. We were in the security of our homes, and we were not facing the discrimination that trans women who are more visible were facing. But eventually, more trans men started coming out, started identifying themselves as trans person. And 2017 onwards, we got included in the advocacy with the government. We ensured that our participation was at maximum. And at that time, around 300, 400 trans men came and fought for the trans rights bill. In December 2019 was when the trans bill got passed and became an act that recognized both trans men and trans women's right, and also ensured that they were not facing any discrimination. And until now, we have seen a huge difference in how trans men are coming out. We are still far away from actually ensuring that trans men are safe and trans men have the right kind of access. But recently, we've been able to expand our communities. We have been able to work with civil society organization and smaller groups to have more community building, more access to information about trans men. And in 2022, recently, we had India's first All India Trans Men meetup, where 70 participants, 70 trans men leaders from across India and different states came together and discussed our challenges with the Ministry of Social Justice and the government departments to ensure that our rights are secured. So that's a brief history about the trans men in India. We'll now move forward to our current study and the design of it. It was in 2017 when we started with a few community consultation, and some of the aspects that we made sure when we had our first few meetings was that this study is going to be led by the community. It's going to involve the community in a way that they participate, they take decisions, and hence we formed a steering committee that is comprised of trans men from different backgrounds and different cities and different languages, to ensure that we have enough representation of trans men in designing the study itself and conducting the study itself. In 2019 was when we had our first community consultation. It was supported by the Canadian Institute of Health Research, and we were able to have consultations in 3 cities with a total of 31 participants in Delhi, Mumbai, and Bangalore. And that is when we got a lot of inputs in a very, very open format discussions with the community members on what is the study supposed to collect data on, what is the objectives, and what are the kind of things that the community suggests that this research should find out. Eventually in 2020, we applied to the US National Institute of Health for a study grant, and then got awarded with the grant in 2021. We started with the qualitative interviews, understood what are the different challenges in healthcare access and healthcare resources available to trans men in India through qualitative interviews. And now we're at a stage where we are up for the quantitative survey in 2022, and we are currently measuring the development of the survey study and ensuring that we take all the findings so far and ensure that they're incorporated in our survey tool. So that's about the history of the study so far. Like I said, the steering committee overall is led by different trans men across India, and a research team with people with the academic researchers from US, Canada, and India, some of whom also identify as transmasculine. So a little bit about the initial community consultations that were held in 2019. We held this in participation with some of the community-based organizations in India who have worked for trans men community building. One of them, Tweet Foundation, Sampurna Working Group, and Aneka Trust in Delhi, Mumbai, and Bangalore, respectively. These community consultations were facilitated by community members, ensuring that there was no language barrier, there was enough translation available to ensure that people from diverse backgrounds could participate in the consultation and offer their suggestions and ideas. The consultations were also approved by the Research Ethics Board, both in India and US and Canada. And then we ensured that the participants had enough freedom in an open discussion format to share important health and human rights issues that they wanted to be researched on during this study. The overall size of the consultation was 31 participants with a age range of 20 to 46 years old. So some of the key themes that came out through the consultations were some of as follows. One, there was lack of access to information at first. People didn't know about the effects of hormones, where to get the surgeries from. So information itself was there in lack. And as you can read, one of the quotes said, we don't have any awareness regarding the hormones, neither the surgeries and the things that you're supposed to know during HRT, what kind of side effects we'll have or what kind of impact it will have on our health was not available at all. Another theme that came out was just the affordability and the quality of the kind of healthcare that was available. There were few doctors that were already providing gender affirming healthcare, but the quality of it and the affordability of it was highly questionable. And that came out as one of the key themes that people wanted to research more on. One more thing that came out was the importance of peer support in mental health amongst the transmasculine community. As one of the quotes says, no psychiatrist is able to help me, rather my friends will definitely help me. Some of the other key themes that came out during the consultation was importance of family support. People believe that in India, if the family accepts you, then your relatives and the world outside is more likely to accept you. And that is one of the key questions that we have incorporated in the study design right now. Another thing that came out was the need for gender recognition process and social policies that consider and protect transmasculine people. The government at that point in time did not have any law or any policies with respect to getting your legal ID changed, and that was a matter of concern for most transmasculine people. As one of the quote reads, you can argue that this is legal gender recognitions about your social safety, but tomorrow if my passport has transgender on it and I'm living as a male person, then anyone can see my passport and might discriminate against me, which means that it is not acting as a protection, but acting as a control over me, and might even harm me or have a bad impact on me. Going further, some of the recommendation that also came through the community consultation with the participant of how they wanted the study to be. One of them was protecting the anonymity and safety of transmasculine people while ensuring that the study of the design ensures the safety and protection of their identities. Another recommendation that came in was that the study should be conducted, or the survey should be conducted both in an online and an offline format, so that more people can access it and more people can participate in it. And also ensuring that there are multiple languages that are covered, considering India has a variety of language that people speak and people can access. Another thing that was strongly recommended by most of the community participants is to share the results not only with the government but with families, and ensuring the results are available freely to use, and ensure that we can use that for a lot of advocacy with the stakeholders. One of the quote that reads is, I think parents will only understand when they see and learn about this from a government side. Once the government understands these issues, the parents are probably more likely to listen to them and understand that there's nothing illegal about it, there's nothing wrong about being a trans man. Going further, this is something that at least the trans men community in India hopes for. There is in the current situation, the government of India has already passed an act, that is Transgender Persons Protection of Rights Act in 2019. They have also recently launched a few schemes called Smile Scheme, which has provisions for skilling, education, shelter, and healthcare and support. And that is why actively using this data and actively using the research to influence the government policy has become a little easier now. We're no more looking for legal recognition, but we are looking to influence some of these key policies. We still know that the government has very minimal understanding of what are the challenges of trans people, and particularly in trans men, because we have been highly invisible and there is lack of data, any kind of research that gives valid information about what the needs of trans people are in terms of healthcare, in terms of just socioeconomic inclusion and just well-being of trans people. And the research data hence is highly important, because it's one of the first study that will influence crucial policy making that is going to happen in coming years for transmasculine people in India. And we do hope that we are able to influence the stakeholders to create policies that can benefit the trans men community in India. Passing on to Ayden and to take forward and share about the study further.
Thank you. That went pretty smoothly. Shaman and I did record that together, so that's why it turned out pretty smooth. So I'm going to talk now about what we did with what we heard from those community consultations. And this here is the conceptual framework from our NIH grant. And I bring it up just to refer back to what I said earlier about how what we're trying to do with this project is think about how privilege and oppression related both to transgender identity, but also to gender relations more broadly in the Indian context, interact to shape what we've termed gendered situated vulnerabilities. So experiences of intersectional stigma, gender-based violence, family experiences, gender affirmation or lack thereof, and healthcare access, which in turn impact a range of mental health outcomes that are our focus for the study. And also, really importantly, how both individual level and community level resilience factors are related to improved mental health and can also buffer the impact of gendered vulnerabilities on mental health. And so what we've been doing so far in the study is that in our first phase last summer now, we conducted interviews, and particularly transmasculine people who we hired and trained from the community conducted interviews. They were supposed to be in person with people in Delhi and Mumbai. Of course, we all know why in person didn't happen. And so we pivoted to do online interviews. And we were supposed to do 30 interviews, but we had such an overwhelming response that we ended up doing 40. One of the real lessons of this project has been that when people tell you a community is hard to reach, it's usually because they don't know how to reach the community. A lot of, when we were even submitting the grant, people said, are you going to be able to recruit people? And that hasn't been a challenge, not because of anything that the academic researchers have been done, but because of people like Shaman and our other steering committee members who have been doing so much community development work alongside the study. And as Shaman mentioned, how much the community networks have grown over the past few years that we've been working together. In the event, we conducted these 40 interviews, and we have a series of community-facing reports that are going to come out first, beginning the summer and through the fall. They'll be on our website, which is ourhealthmatters.in. I'll show you that at the end as well. And then later, we'll do a series of academic papers, but we're starting with multilingual community reports. In the interviews, we ask people about experiences of family acceptance and rejection, access to healthcare and discrimination in healthcare, their experiences with legal gender recognition. Because we were in the middle of the pandemic, we of course also asked about the impacts of COVID-19 on their health and their social well-being, and then asked about mental health challenges and what kind of supports people wanted to see. And again, we heard a lot about the importance of peer supports. We spoke to 40 people, as I mentioned, came from a range of ages, mostly on the younger side. So the average age was 28, which I think speaks to both the reality that for many older folks, access to transmasculine identity didn't necessarily exist. And so it is a younger community, at least of people who are out and visible as trans. And of course, the fact that we had to recruit online because of the pandemic. Importantly, we also really strove to have diversity in terms of religion and castes, taking an intersectional approach and recognizing that in India, caste remains a really important predictor of health and well-being. I'm going to highlight findings from two areas of the qualitative interviews. These are preliminary findings. We are deep in the midst of analysis right now. And we started with these topics because gender-affirming healthcare was a priority for our steering committee. So we started there. And then the other theme I'll talk about is around family acceptance and rejection. And we had a more pragmatic reason for starting there, which is that, as I'll show you, we wanted to develop survey measures that were responsive to the cultural context, rather than just taking measures of trans-specific experiences that had been developed by and for US or global North populations. So in terms of gender-affirming healthcare, we've organized our findings into these themes reflecting a process that people go to. So beginning with finding information, which, as Shaman mentioned earlier, can be really challenging, particularly because so little information is available in languages other than English. One thing we're doing right now is actually, we wanted to provide information on the study website about sort of testosterone 101, because there actually aren't any resources about hormone therapy that are accessible to community that were available in Hindi, never mind in other languages. And so we're taking a resource that was developed by the Asia Pacific Trans Network and translating it into Hindi so that it can be available to community members. So finding information was a real, an important issue for folks. Then actually finding services, and as Shaman mentioned, finding services that are affordable. And then finding services that are supportive was an additional layer that people had to go through, and of course, often experiencing quite negative healthcare encounters in that process. If for people who needed access to hormones, the next stage they went through was what we've called passing the test, And this was around having to go through assessment processes to get referrals for hormones that were often not very helpful, and it could be quite challenging for people to actually get the referrals they needed. And then more positively, people actually being able to achieve their goals in terms of gender affirming care. And I'll walk you through each of these stages. So in terms of finding information, of course, people went online, but as I mentioned, online searches weren't always that helpful because almost everything available was in English. And so informal peer supports were how most people found information about where to access care. So this quote on the right from a participant talks about how he made friends with other trans men on Facebook, and through that came to know where he could get access to gender affirming care in Mumbai. In terms of finding services, issues of cost and affordability were really central. And keep in mind that we spoke to people online, so we were accessing a population of people who aren't as economically marginalized as many others would be. And so this participant on the right talks about how he had interruptions in his hormone therapy because he was unemployed. Other participants we spoke to reflected on their choices of accessing private versus public care. So in India, in theory, it's possible to access hormone and surgical care through the public system, but wait times can be extremely long and the quality of care can be really suboptimal. So many people chose to access private care, even though it meant, working multiple jobs, having to borrow money, having to really struggle to be able to make those payments. In terms of positive and negative experiences, of course, there are negative experiences in accessing healthcare for trans people globally. So what I'll just highlight is that people also had positive experiences, which I think is really important to highlight. And this was really in the absence of much work to educate providers around trans care. That's changing. There's actually right now a project going on led by folks at the University of Chicago in collaboration with the Sangat Institute in India that is doing trans cultural and clinical competency education for healthcare providers, but that work is fairly new. So I talked before about this theme of passing the test. And so this was something that our participants colloquially referred to as acquiring a GID certificate. So GID stands for Gender Identity Disorder, which is the old diagnostic category from the DSM for what is now called gender dysphoria, but in the community it's still referred to as a GID certificate. And the World Professional Association Standards of Care for Trans Health, the current version that's going to be updated this year, recommends that people have, to start hormone therapy, that adults have either one referral from a mental health provider or a psychosocial assessment by their primary care provider if that provider is qualified to assess trans folks and has relevant competencies. The standards of care do not require that people actually be given a diagnosis of gender dysphoria or any other diagnostic category in order to access care. But what we heard from our participants, I think, really speaks to how supposedly global guidelines that are open to interpretation will often be given the most conservative possible interpretation, and that really restricts care. And in 2020, the Association for Transgender Health in India actually released a set of Indian standards of care that build on the global WPATH standards. And there's a really important document that's really progressive in many ways, including really strong attention to the social context. But those guidelines are actually more conservative than the WPATH global guidelines in that they recommend that people have 2 mental health assessments in order to access hormones, including one by a psychiatrist. And in a context where there's very limited access to affordable mental health care in general, never mind to trans competent care, that becomes a huge barrier. And so participants spoke about how they had to try many times to find a provider who was willing to give them an assessment, then struggled to actually get the official certificate or referral letter that they could then bring to a hormone provider. And as this participant reflects, the assessment was also not useful for folks in that they had to put on a performance to get what they needed. It was jumping through hoops. It was gatekeeping. This participant said, "My friends told me that whatever questions are asked by the doctor, I have to speak positively. If I feel disturbed or negative or uncomfortable, the doctor will cancel the GID. I answered positively and gave the test, and after the test, they gave me the certificate." And these kind of gatekeeping experiences are what I experienced when I started accessing hormones in Canada 18 years ago. And that's something that's become less common with, in many settings, a decrease focused on gatekeeping. And again, I think this really speaks to how the global diffusion and sort of conservative interpretations of so-called standards for trans health have really created barriers to folks getting gender-affirming care, and if they have mental health concerns, actually being able to get those met. More positively, we also heard a lot from folks about how wonderful it was once they did manage to jump through those hoops. This participant says, "It felt great when I saw myself. It seemed that now I was changing. I'm getting or going to get what I want in life." So I'm going to switch to the second theme that I'm going to highlight some of our preliminary results from, and this is around family acceptance and rejection. And as I mentioned, part of our reason for really digging down on this theme is that our participants in our consultations told us how important it was to them. And we wanted to be able to measure people's experiences in our quantitative survey in a way that was culturally appropriate and got at the nuances of how important family support is in a more collectivistic culture. And this quote at the top, there are many quotes in the data that have a similar message to this one. This is one participant who said, "The world can say, if you don't get support from your family, then why should we support you? The world can start from the family. If your parents are with you, then it isn't an issue, whether friends, girlfriends, or boyfriends are with you or not." And importantly, we heard lots of examples of family acceptance from our participants. So for example, people using their chosen name or pronouns, or calling them a brother or a son. We heard about support for gender expression, or at least non-interference in people's gender expression. So this participant talks about how his parents never told him to wear girls' clothes or play girls' games, and they never stopped him. They let him keep his hair as he wanted. We heard about expressions of happiness or pride in the child. Name here is obviously changed for confidentiality. My mother has told all of my relatives what I have done. Earlier, my name was Arya. So mother tells them, "Arya has done this. My mom is proud of me." And then we heard about support for medical transition as well. This was a nice narrative about a participant's mother who said, "It's your life. You know how you want to live. And you should call me when you have an operation, and I will come." We also heard from most participants about experiences of family rejection as well. And of course, these are not separate experiences. Many participants experienced rejection from one parent and support from another, or rejection that over time turned into acceptance. One of the most common manifestations of rejection was pressure to have a feminine gender expression, which for some participants moved over into attempts at gender identity or expression change, or what's colloquially called conversion therapy. So this participant said, "My family forced me to live like a girl and forced me to take medicine for about 4 to 5 months." We heard participants whose parents took them to psychiatrists for so-called conversion therapy, as well as to Ayurvedic doctors or spiritual healers. When this participant said, "They took me to a psychiatrist, the doctor told them that I was mentally sick and should be given female hormones." Pardon me. We also heard about experiences of violence. Sorry, I got a tickle in my throat unrelated to the dramatic story subject matter. This participant said, when I used to wear shirts and pants, they would hit me and scold me. I've had a lot of beatings, and so I got strong and adamant that I would not care if anyone hit me anymore. We also heard from participants who had experienced loss of financial support or being kicked out of home. So this participant said, they said to me, don't stay here, and that I should do whatever I want to do after leaving the village using my own money. And then finally, a lot of people had family members who perhaps were actually not unsupportive of their gender, but who restricted the support they showed because they were worried about courtesy stigma or stigma by association. So this participant said, if there's an event in the family, I avoid it. They've accepted me, but they do not accept me in front of others. And then in terms of impacts of family acceptance and rejection, I think these two quotes are really illustrative of how this impacted people's well-being. So in the quote on the right, we hear from a participant who had really strong family support. And he says, the most important thing for me is that my parents have accepted me. It does not matter to me what society says. My depression has reduced a lot due to my parents' acceptance. The other participant on the left talks about how his family has not been accepting. He says, I have certain goals and I'm not able to focus on those as people are not accepting me. They think of me as a girl, and girls are not supposed to go out. Girls should put on makeup and they should not wear clothes as I do. I cannot live my way the way I want to. And this really speaks to the theme I mentioned earlier of how gendered social control and patriarchy intersect with transphobia to really limit the ability of some of our participants to be able to explore their gender expression and live as in their true gender. And so we're using what we heard from our participants, as I mentioned, to develop measures that are contextually appropriate. So these two items at the top of the slide are from a measure of family rejection that we're developing. And as you can see, these two items really get at issues of family reputation and courtesy stigma. So my parents worried about how my gender transition would affect the family's image or reputation. And my parents thought others would treat our family poorly because of my gender transition. And then on the bottom, you can see what we've also done is we have taken some measures from global North context. So this is a measure, an item that we're adding to the gender minority stress and resilience measure developed by Testa and colleagues, but we're adding items that get at how, in this case, gender non-affirmation manifests in the Indian context. So, you know, gendered bathrooms are a universal phenomenon, but in many Indian urban centers, you have to go through security screenings as a matter of daily life. So to get on the subway, to enter a mall, and those screening lines will be gender segregated. So it adds a whole nother set of spaces. And maybe you can avoid, many trans people will avoid going to the bathroom in public all day, but these security screenings you often cannot avoid if you need to get on the subway, for example. And so we're adding items that get at how that impacts people. So we're in the process of finalizing our survey, pilot testing and translating it, and we're going to launch it this summer in 3 languages. Based on what our participants told us, even though it makes the science a bit messier, it's going to be available online. It's going to be available in person with research staff who will have tablets in 4 regions of the country. It's also going to be available by telephone. And we're going to, of course, provide an honorarium for participants, but also allow them to decline it so they can remain completely anonymous and not have to share contact information. And we'll also do a little bit of research to compare how these different recruitment strategies work so that we can understand how to do other kinds of studies similar to this one in the future, both in India and elsewhere. So I'll leave it there. I want to acknowledge our funding, of course, from the Canadian Institutes of Health Research and the US National Institutes of Health. As I mentioned, we have a website, which is ourhealthmatters.in. We're also on Facebook and Instagram. Also want to acknowledge by name Tweet Foundation and Transmen Collective, who are our community partners, and the Population Council, who are our implementation partner in India. And I already mentioned the team members, but want to thank them again. And I look forward to questions and comments, and thank you for your patience with my sudden throat tickle.